Data doesn't lie, your go-to for the science behind the art of parenting.
Hi folks, this week we are going to talk about COVID-19 and newborns, and I'm going to answer some of the frequently asked questions around this topic. I'm going to use my phone so I make sure I get to all of them. They're going to be a total of about 8. It's not going to be a long video, don't worry about it. Again, short and sweet. So let's dig in. So the first one, what do we currently know about the risk newborns face with COVID? So looking at all the multiple international studies that we've had to date, as well as national studies, the AAP, American Academy of Pediatrics, updated their guidelines at the end of July 2020, and that's where I'm pulling this data from. So newborns born to COVID-19 positive moms have about a 2 to 5% risk of testing positive if they're born near the time of delivery or near their due date. What we don't know per the AAP registry, the babies who were reported to the AAP registry, is if any of these newborns eventually fell sick or ill at home. So the risk for newborns is approximately 2 to 5%. What we know, they have a lower risk of testing positive or getting ill. What about delayed cord clamping? We talked about this in our previous video, how beneficial it is. Should we continue delayed cord clamping where the blood from the placenta gets to the baby? The current recommendations are that yes, we should continue it, but practice safely while doing that. So moms are wearing masks while the babies are on their chests, so respiratory particles are not getting to the babies. The next question is, can mothers and babies room in? So depending on what hospital or what institution you deliver at, their guidelines would be specific to that hospital, but the general recommendations are that we have not seen, so the risk of a baby who rooms in with the mom under protective conditions, meaning 6 feet apart, mom wears a mask, cleans her chest, a baby is in the incubator or in a crib with a curtain or a screen in between mom and baby in the same room, versus a baby who's in a completely separate room separated from mom, the risk for those two babies testing positive for COVID-19 is the same. So there's no decreased risk if the baby's separated from mom. And this is, again, looking at the multiple international national studies. So the risk is no different, then one can argue that it's okay to let baby room in with mom, but practice protective measures, keeping them 6 feet apart so mom's respiratory particles don't get to baby. The second fact supporting this recommendation is that so far to date, we have had no newborns die during that first hospitalization, their birth hospitalization from COVID-19, directly from COVID-19. So again, they don't have severe illness. So your next question, can moms breastfeed their babies if they're COVID-19 positive? So there are quite a few studies that have demonstrated nucleic acid or particle of the virus in the breast milk, but they haven't demonstrated an active virus in the breast milk. So the active virus is what transmits the disease, right? So because they haven't demonstrated an active virus in the breast milk is still currently, or breastfeeding is still currently recommended. Again, under protective conditions, right? So mom is wearing a mask, she cleans her chest, she changes her clothing prior to interacting with the baby, washing hands and stuff like that prior to at each interaction with her baby. What happens if my baby requires intensive care or needs to go to the NICU? Unfortunately or fortunately, baby is going to be in a single patient room that has negative airflow, the point being to be able to get the virus out of the circulating air such that people are coming into the room, or when the door opens it doesn't swoosh out into the corridor or anywhere else. So baby's going to be in a single room until baby's tests come back negative, or if they stay positive, then the baby stays in that room. How do babies get tested for COVID-19? Yes, babies do get tested for COVID-19. It's the same swab we do for adults. where we do, but the difference with the baby swabs is before swabbing the baby, we give the baby a bath so that we wash away any potential viruses that the baby may have gotten on their skin from the mom. So we don't want a false positive. So give the baby a bath, and then we do the first swab for the baby at 24 hours and the second one at 48 hours. Nowadays, we're tailoring it down to potentially just one swab for the baby, but either way, that first swab gets done at 24 hours of life, and it's still a nasopharyngeal swab. What happens with visiting parents in the NICU? Again, this is one of the unfortunate situations where if the parent or one of the parents tests positive for COVID-19 and or is symptomatic, has symptoms, we don't allow visiting into the NICU, depending on the type of NICU you have. Again, if the parent could be infective or infectious, then visiting would be restricted. So this particular recommendation would be specific to whatever hospital you deliver at. But the thought around that is, if you are likely to be infectious, you're likely to have restricted visiting with your baby. And I think the last question would be, what happens with just discharge? How does my baby get discharged from the hospital if I have COVID-19? So the discharge criteria for babies has not changed, meaning if nothing happened, if baby did not have the risk factor of having a COVID-19 mom or having a test that was COVID positive, baby would go home when baby was ready. So if it was a vaginal delivery, typically 24 to 48 hours. If it was a C-section, about 3 to 4 days. Peeing, pooing, eating well, all those things would still stay the same. The only difference in this particular scenario is baby's follow-up. Baby would have to be seen pretty frequently in the first 2 weeks to make sure the baby's not developing symptoms, and then you would be practicing protective measures at home, again, so washing hands, face masks, cleaning your chest prior to breastfeeding, things like that. So it would just be a little nuanced, but baby would be ready to go home at the same time that any other baby would be. And yeah, those are the questions that you guys asked me. Let me know if you have any other questions. I will just put them in the description, in the comment section below, or email them to me. Sorry, that's what I was trying to say. Share, like, and subscribe, and I will see you guys next week.